Today we will be talking about HEAR reports. We will include what a HEAR report is, what's in a HEAR report, the do's and don'ts of a HEAR report, an example of a HEAR report, and the hospital's perspective on HEAR reports. I'm Zach Farnes. I graduated the Schmeketa Fire Program in 2017, and I will be in the Schmeketa Paramedic Program starting in spring of 2018.
My name is Tyler Schlotteroff. I also graduated from the Schmeketa fire program in the summer of 2017, and I'm applying for the Schmeketa paramedic program in the fall of 2018. Today we have a guest speaker. Her name is Haley to give the perspective from the hospital and hear reports. She's an ER nurse at Salem Hospital for the last 4 years and was formerly at West Valley Hospital. So what is a HEAR report?
Good question, Tyler. So a HEAR report is an over-the-radio report from the ambulance to the hospital. It's a quick report and a relay of important information about the patient. The time the HEAR report is given varies. It's based on the severity of the patient and the distance of the hospital. If the patient is stable, the HEAR report is typically reported 2 to 5 minutes prior to arrival. If the patient is critical or unstable, for example, trauma activation, STEMI activation, or neuro alerts, the report can come in as quickly as when the medics finish their assessment on scene or when leaving the scene. The distance of the patient can affect the time of the HEAR report also. If the scene is 1 minute away from the hospital, the report will be given moments before arrival. If the scene is 20 minutes out, the report can be given when medics are closer to the hospital. The HEAR report gives the hospital a quick description of the patient, what has been done to the patient, and what resources will be needed to prepare the patient for the hospital. So what's in a HEAR report?
Glad you asked, Zach. Here's an example of an outline to follow when giving your HEAR report to the hospital. First, give your agency's name and the unit number of your medic. For example, Marion County Medic 31. What's the age of your patient? And also the sex, are they male or female? The hospital also wants to know the GCS if the patient is altered or anything under 15. Next, they want to know the chief complaint. Why did the patient call you for help? What happened at the scene? Also, they want to know the pertinent positives or negatives. For example, are they having chest pains? And are they also having shortness of breath with their chest pain? Are they having belly pain? Are they having arm or leg pain as well? And are there any open fractures? The hospital also wants you to cover OPQRST if the patient's having pain. They want to know when it occurred, what makes it better or worse, the quality of the injury or the illness, the radiation of pain, and the severity, and also what time did this happen. Some of the important vital signs that the hospital wants are the blood pressure, heart rate, respiration rate, SpO2, and the CBG, if you can attain it. Also, they want to know past history, allergies, or medications, anything that relates to the illness or injury of the patient. Also, they want to know what treatments we did for the patient and interventions. They want to know all the treatments we did and what outcomes the patient had due to these treatments. Finally, they want to know any other information that might help describe the patient's condition. Are they combative? Do they need respiratory support? Are you bagging them while you're bringing them in? Are they a trauma entry? Did they fall? Did they hurt their head? Is the patient on drugs? Are police coming in with you? Are they in the back of the ambulance? Or are they riding along behind you? Are there parents with the patient? Is it a kid? Is the patient deaf? Are they blind? Are they mute? Or do they require an interpreter? And any other important concerns or information that was not mentioned earlier.
The outline of the HEAR report is going to change depending on each patient. Some things you won't need to mention if it's not important, and some things you'll have to include if it is important for the hospital to know.
Here are some of the do's and don'ts of a HEAR report.
Do's: practice what you're going to say if time allows. Be accurate, honest, and objective, and always be clear and concise.
Some of the don'ts: don't give non-important information. Don't give irrelevant details. Don't give speculations. Don't mumble or be long-winded. And try to be with under a minute if possible. Hey, Zach, can you give us an example of a HEAR report?
Sure, here we go. County Hospital is Medic 105 en route to your facility with a 57-year-old male complaining of chest pain, shortness of breath, and nausea. Physician on site requesting transport to rule out MI. Pain, 7 out of 10, non-radiating, dull in nature. It's been going on for the last 2 hours. Vital signs are stable, sinus on monitor. Patient received 1 aspirin and 2 nitros without relief. IV established. ETA is about 10 minutes. Are there any questions or orders?
As you can tell, this HEAR report was clear and concise. It gave what the patient's condition was, what treatments we gave, and also the patient's response to those treatments, all within a short period of time. The hospital now knows what resources they need and how to be better prepared for when the patient arrives. So here's our guest speaker, Haley. She works at Salem ER, and she is here to give the hospital's point of view on HEAR reports. So, what are your expectations that you want the medics to give?
The biggest thing, like you guys have already discussed, is being clear. If you're mumbling, if there's noises in the background, especially if the patient is screaming or something like that, try to avoid those times to give a HEAR report. I can't hear you. I don't know what you're saying. And then if I have to ask you to repeat yourself, it takes you more time during a HEAR report, and it takes up more of our time. We also expect that it's simple. Like, if they're having chest pain, I want to know they're having chest pain. I don't care, like, don't tell me they're having chest pain. Oh, but they don't have leg pain, they don't have arm pain, they don't have any of these. Like, I don't need to know that information.
So Haley, could you tell us about the ER nurses' attention spans during HEAR reports?
Yeah. So I've worked at 2 different hospitals. I worked at West Valley ER in Dallas first. That hospital was a lot slower, a lot easier to take a HEAR report, and any nurse there took HEAR report. It just was whoever was sitting next to the HEAR report system at the time. So we had time to chat over the radio usually, and could get as much information as possible. However, working at Salem now, it's a level 2 trauma center, 60-bed ER. Well, we just had an expansion, so now 67-bed ER. It's very busy. We don't have the time, and the PFC, the patient flow coordinator, is the one taking HEAR reports. They're not directly taking care of the patient. So all they need to know is ultimately, like, the resources that they need. Do we need cath lab on standby? Do we need a trauma surgeon there? Do we need respiratory therapy upon arrival? Do we need security upon arrival? And does the patient need a room right now, or can they wait? Can they go to triage and wait in the lobby for a little bit? Are they stable? Things like that, because you're going to give a full report to the nurse that takes care of that patient once you arrive. So the attention span of the PFC is much smaller, 30 seconds max usually. They have phones going off that they have to answer. They have 2 monitors, and they have cameras going all at the same time. And usually, there's a medic or 2 standing in the hallway staring at them. So we don't have time to deal with long-winded reports. Usually you get interrupted in the middle of it and have to take a phone call anyways. So.
So Haley, can you tell us the importance of HEAR reports for the hospital?
Yeah. So with HEAR reports, like I said before, the patient flow coordinator takes that report. If a patient has chest pain, it's ultimately the best practice that we get them seen right away by a physician. We get their EKG within 10 minutes. So we need to know and be prepared so that we can have a room ready when that person arrives. Ultimately, if you can give us a little bit of time, like with trauma entries and things like that, if you can give us 10 minutes, have a room ready, we can have all the supplies that we need. We can have the trauma surgeon on the way. We can have teams and everything in place in that room. So as soon as they arrive, we're ready to go. Same thing with respiratory distress. If someone's on CPAP and you're on their way in and you tell us they're on CPAP, then we need to have respiratory therapy there, potentially a BiPAP machine there, or potentially ready to intubate, depending on the patient status. So it's super important to us, for us to know what to expect when coming in. You guys get a quick synopsis from dispatch before you arrive, so it's the same thing. We need a quick synopsis from you guys on what we expect, what to expect of the patient coming in. Especially if the patient is extremely painful, screaming, things like that. But we also have patients that come in by medic that treat the ambulance as a taxi. Toe pain, dental pain, things like that. Those people can wait. Those people don't need a room right away. So it's super important to know what we have coming in so that we can be prepared.
All right. Can you explain some of the differences in the HEAR report that we gave to what you expect or what you're used to?
Yeah. So you guys are taught, to give us as much information as possible, but only give the pertinence, which is true. However, truthfully, we respect the medics and the EMTs education. You guys are trained just like we're trained. So you don't need to give me in the HEAR report every vital. I don't need to know their heart rate's 80 when it's within normal limits. I don't need to know their blood pressure is 120/70 when it's within normal limits. So that's why I always recommend to people that I know, if their vital signs are stable, tell me vital signs stable. Or tell me vital signs stable except they're hypotensive or hypertensive. And then you can give me that number. I don't need to know every number, especially I don't have time or energy to write down every number. You're going to give all the full vitals to the nurse that takes that patient in official report. So HEAR report, just keep it simple. Give us the down and dirty. So in your example, you did great, giving us just vital signs stable, sinus on the monitor. That's exactly what we want to hear. However, most people are trained to give us every single vital sign, the exact blood pressure, the exact blood glucose, the exact respiratory rate. If the respiratory rate's 12, that's normal. So don't tell me 12 because then I'm just going to say it's normal. So definitely that's a big difference from what medics practice and what we like. We prefer just hearing from your perspective, are they stable, are they not? Also with HEAR reports, like, chest pain and shortness of breath usually go together. So it's definitely good to know if they're having chest pain and shortness of breath. And with a trauma, we need to know like most of their injuries, but we don't need to know everything. So if they're a trauma and it was a rollover, tell us, it was a rollover accident with a head injury and a leg injury or something like that. We don't need to know exact specifics in the moment.
In summary, HEAR reports are important for continuity of care for the patient. The biggest thing is being quick and clear. We are all educated and must use our education to better patient care. The hospital needs the important information so they can be prepared, so we need to do our part in helping them get the resources available and what they need.
As we know, it'll take time to become proficient at HEAR reports. However, with practice, we can provide the best emergency services. Also, always remember the hospital can ask you questions if something was unclear. Hopefully, our presentation helped you learn something and become more comfortable with your reports.
Do you have any questions or orders? Thank you.